So this question is a single question, but it's loaded. It's very, very important question. The same thing I'm going to do. Which of the following medication, this can be a case form you can get, responsible for such findings? So my being asked is med that will give me this finding. What kind of findings? A client was involved in motor vehicle collision with a severe brain injury requiring intubation. So client was intubated. 7 days post-intubation, client had what? Acute onset of lactate rising. K is 5.7. There's peak T waves. Patient has fever. He has AST elevated, triglyceride elevated, CK 20,000, and creatinine 2.5. This can be a full case for you. And it's a content I want you to know on pharmacology. What is going on? So intubated, right? So let's see what we have. Somebody is intubated. All of a sudden, lactate going up, right? What else do we have? We have K up. So hyperkalemia, right? Then I have EKG changes. I have what? Fever. I have liver failure. Okay, liver AST of 500 is going up. Triglyceride up, right? I have CK 20,000 greater than 2,000, 20,000. So that is like rhabdomyolysis. And the creatinine up, that's acute kidney failure. Which medication is responsible? Even if you don't know it, you can start to eliminate. I know fentanyl does not do that. Fentanyl is a pain medication. Okay. But all these things can be used to intubate the patient. You can start from Sasinoco A. If you recognize it, this is, they don't give it to you continuously. This one, they give it to you once they intubate you. This is paralytic. It will paralyze you, and then they will intubate you. That's all. But this happens 7 days later, so you should know. What I know, they give it to you when you sedated and intubated is what? Midazolam, okay, which is Versed, fentanyl, opiate. This is benzo and propofol. This is sedation medication. So propofol and benzos are used for sedation. Fentanyl is used for pain, right? And I know opiate, this is fentanyl, it's an opiate. I know side effect is like what? Respiratory depression, and then constipation, hypertension. All these things are different. Therefore, I can eliminate this. What is going on? I know midazolam does not affect your triglyceride. Okay, I'm trying to break the question down. Therefore, I'll be left with propofol. And yes, propofol, it looked like fatty. It looked like TPN basically when they give it to you. It's like white chalky thing they give it to you. It has a lot of fat. And there's increase in free fatty acid. But it blocks your body from taking any glucose or fatty acid inside. So it blocks your ATP. It affects the mechanism of electron transport chain. So there's acute accumulation of free fatty acid. This can lead to the muscle, they don't have any food. So muscle death. And everything starts from muscle death. The muscle is dying, so you have rhabdo. Your heart is a muscle, will go into cardiac arrhythmia, right? And when muscle is dying, they release potassium. That's why you get high potassium and you get a peak T waves, right? And then this will go to your kidney and cause acute kidney injury. It also affects your liver because the liver cannot break down all these fatty acids, and then it becomes a problem. It go overwhelmed. So acute, and why do we have lactic acidosis? It's because of the anaerobic respiration. So you build up, you have lactate building up because now the tissue the cells are dying and you get into this form. So acute rising of lactate, so lactate problem, hyperkalemia, fever, triglyceride, and kidney problem. So you have kidney, your lung, your heart, and your muscle. That is Propofol syndrome. That's what it is, acute Propofol syndrome. And that is what the name they call it. So the answer choice is Propofol. So the patient is taking Propofol, and that's why we don't put people on Propofol more than 48 hours, between 48 to 72 hours. When we get to that stage, we worry that we have to do something. And so we will stop those medication from letting them do anything. So we change the Propofol to another medication. So that's it.